Why do some drugs cause allergic reactions with MHC? Imagine your immune system as a vigilant guard, always checking for threats. Now, think about how it recognizes what's foreign and what's part of your body. That's where the major histocompatibility complex, or MHC, comes into play. These molecules are like display cases on cell surfaces, showing tiny pieces of proteins from inside the cell. They help T cells decide if a cell is normal or infected. Usually, MHC presents self-peptides, which your immune system learns to ignore. But sometimes, drugs can change this process in surprising ways. Certain drugs are small molecules that can interact with MHC molecules. They can do this in a few different ways. Some drugs bind directly to the MHC, changing its shape. This alteration can make the MHC present different peptides than usual. Other drugs form complexes with proteins inside cells, creating new structures called hapten carrier complexes. These are then processed and displayed by MHC molecules as if they are foreign. When this happens, the immune system may mistake these altered or new peptides for invaders. A well-studied example is the drug abacavir, used for HIV treatment. It binds specifically to a type of MHC molecule called HLA-B5701. This binding changes the peptides that HLA-B5701 presents on the cell surface. The immune system then sees these new peptides as foreign and launches a response. This leads to a hypersensitive reaction, which can be severe. Interestingly, only people with this specific MHC variant tend to have this allergic response, showing how genetics play a role. When T cells recognize these drug-modified peptides, they become activated. They release chemicals that cause inflammation and tissue damage, resulting in allergy symptoms. This process is called a type Roman IV hypersensitivity reaction. It usually takes some time to develop because T cell activation and response are not immediate. Not everyone with the same MHC variant reacts the same way. Other factors influence whether an allergic reaction occurs. These include the presence of specific T cell clones, genetic differences in how peptides are processed, and immune regulation. That's why some people can take a drug without any issues, while others have a strong allergic response. Understanding how drugs interact with MHC has practical benefits. Doctors now sometimes test for certain MHC variants before prescribing specific medications. For example, testing for HLA-B*5701 before giving abacavir can prevent dangerous allergic reactions. This personalized approach helps keep patients safe and shows how important MHC molecules are in immune responses. In summary, some drugs cause allergic reactions because they bind to MHC molecules and change the peptides they present. This tricks the immune system into thinking these peptides are foreign, triggering an immune attack. It's a fascinating example of how tiny molecules can influence immune behavior and why genetics matter in drug reactions.